As you all know that vitamin E is a fat soluble vitamin with several forms, but alpha tocopherol is the only one used by the human body. Its main roles is to act as an antioxidant, scavenging loose electrons called free radicals that can damage cells. It also enhances immune function and prevents the clots from forming in heart arteries. Antioxidant vitamins include vitamin E, came to the public attention in the 1980s when scientists began to understand that free radicals damage was involved in the early stages of artery clogging, atherosclerosis, and might also contribute to cancers, vision loss, and a host of other versatile chronic conditions. Vitamin E has the ability to protect cells from free radical damage as well as reduce the production of free radicals in certain situations. Vitamin E is thought of as a single compound. It's actually a group of 8 fat soluble compounds with powerful antioxidant effects. These 8 chemical forms in which alpha tocopherol best meets the dietary requirement of humans. Vitamin E exists in certain foods including seeds, nuts, vegetables. You can also take vitamin E as a dietary supplement. Oxidative stress is a condition that occurs when there is an imbalance between your body's antioxidant defense and the production and accumulation of compounds called reactive oxygen species. This can lead to cellular damage and increase the disease risk. Because vitamin E acts as a powerful antioxidant. Vitamin E is required for proper functions of many organs, enzymatic activities, and neurological processes. Vitamin E is very important in helping our bodies make red blood cells and helps the body use vitamin K, helps to maintain the stores of vitamin A, vitamin K, iron, and selenium. Vitamin E is necessary for the structural and functional maintenance of skeletal muscle system, cardiac muscles, and smooth muscles. There are several causes of vitamin E deficiency. Individuals who cannot absorb fat properly may develop vitamin E deficiency. Some conditions such as chronic pancreatitis, cystic fibrosis, and Crohn's diseases. These are some example may prevent able to absorb fat soluble nutrients such as vitamin E. These disorders do not absorb the vitamin E, always resist in the absorption of the vitamin E. Ataxia is a rare genetic condition. This condition is basically neurologically based and affects the muscle control and muscles coordination. It usually develops in children between the ages of 5 and 15. Low levels of vitamin E can cause digestive issues, which will lead to poor absorption of nutrients. This can cause diseases in pancreas, liver, and gall gallbladder. There may be some symptoms of vitamin E deficiency, which include dry hair, hair loss, chronic diarrhea, muscle weakness, loss of muscle, abnormal eye movement, impaired vision or maybe blindness, impaired speech, leg cramps, fertility issues, nervous systems problems in the hands, legs, arms and feet, pain, tingling and loss of sensation in arms and feet, gastrointestinal diseases, slow healing of tissues. Most people get the right amount of vitamin E from their diets. Vitamin E is found naturally in many foods, nuts, seeds, vegetable oils, and leafy green vegetables. If you have too little or too much vitamin E in your body, it can cause serious health problems. A vitamin E test may be used to find if you are getting enough vitamin E in your diet. Find out if you are absorbing enough vitamin E. Your diet supply the adequate amount of vitamin E. Certain disorders cause the problem with the way the body digests and uses the nutrients, such as vitamin E. You may have adequate supply of vitamin E through your diet, but your body's such disorders can create the low absorption of vitamin E. Check the vitamin E status of premature babies. Premature babies are at a higher risk of vitamin E deficiency, which can cause the serious complications. And find out if you are getting too much vitamin E. It is very necessary to keep an eye on your diet supply of vitamin E. Always make sure that you have an adequate supply of vitamin E through your diet. If you have adequate supply of vitamin E in your diet, it may be possible that you are absorbing the enough vitamin C, but certain disorders, some body conditions can cause the problem with the body digestion and uses of the vitamin E. And find out you are getting too much vitamin E. Vitamin E test may be used for all these purposes. Do you think that our why do I need a vitamin E test? You may need a vitamin E test if you have symptoms of vitamin E deficiency, not getting the or absorbing the enough vitamin E, or vitamin E excess, getting the too much vitamin E. The purpose of vitamin E test is to measure the deficiency and access any excess of vitamin E in your blood. Symptoms of vitamin E deficiency may include muscle weakness, slow reflexes, difficulty walking, vision problems. Vitamin E deficiency is very rare in almost all healthy people. Most of the time, vitamin E deficiency is caused by a condition where nutrients are not properly digested or absorbed. Understand? Vitamin E deficiency is usually associated with the condition, any condition, when body is unable to digest or absorb the nutrients properly. Body cannot able to handle the nutrient properly. This is the main cause of vitamin E deficiency. These includes Crohn diseases, liver diseases, cystic fibrosis, and some rare genetic diseases. Vitamin E deficiency may also be caused by a very low fat diet. Symptoms include diarrhea, nausea, and fatigue. These are the symptoms of vitamin E excess. If you have excess amount of vitamin E in your blood, your body shows some symptoms which include diarrhea, nausea, and fatigue. Vitamin E excess is also very rare. It's usually caused by taking too much vitamin. If not treated, excess vitamin can lead to serious health problems, including an increased risk of stroke. What happens during a vitamin E test? A healthcare professional will take a blood sample from the vein in your arm using a very small needle. After the needle is inserted, a small amount of blood will be collected into a test tube. You may feel a little sting when the needle goes and in and out. This usually takes less than 5 minutes. You will probably need to fast, not eat or drink, usually for 12 to 14 hours before the test. There is very little risk to having a blood test. You may have slight pain or bruising at the spot where the needle was put in, but most symptoms go away quickly. A low amount of vitamin E means you are not getting or absorb enough vitamin E. Your healthcare provider will probably order more tests to find out the cause. Vitamin E deficiency can be treated with vitamin supplements. High vitamin E levels mean you are getting too much vitamin E. If you are using vitamin E supplements, you will need to stop taking them. Your healthcare provider, your doctor, may also prescribe other medications to treat you. Many people believe vitamin E supplements can help prevent these certain disorders. But vitamin E has any effect on heart diseases, cancers, eye diseases, or mental function. But there is no solid evidence of this association between the vitamin E and heart diseases, cancers, and eye diseases and mental functions. Severely vitamin E deficiency results mainly in neurological symptoms, including impaired balance and coordination, which is called ataxia, in injury to the sensory nerves, muscle weakness, and damage to the retina of the eye. For this reason, people who develop peripheral neuropathy, which is injury to the sensory nerves, ataxia, which is the impaired balance and coordination, of unknown causes, should be screened for vitamin E deficiency. The developing nervous system appears to be especially vulnerable to the vitamin E deficiency. Children with severe vitamin E deficiency at birth experience rapidly irreversible neurological symptoms if not treated with vitamin E. Individuals who develop gastrointestinal disorders affecting vitamin E absorption in adulthood may not develop neurological symptoms for 10 to 20 years. It also should be noted that neurological symptoms caused by vitamin E deficiency have not been reported in healthy individuals who consume the diets low in vitamin E. Vitamin E deficiency is usually rare. Marginal intake of vitamin E is relatively common. Between the year of 1988 and 1994, the US National Health and Nutrition Examination Survey 3 examined that dietary intake and blood concentration of alpha tocopherol, and the report is that one third of all the participants had the blood concentration of alpha tocopherol below than 20 micromoles per liter. A cutoff value chosen because of its initial association with an increased risk for cardiovascular diseases. Cigarette smoking is thought to increase the utilization of alpha tocopherol, such that smokers might be at increased risk of deficiency compared with the non-smokers. Essential to the central nervous system. It is among the body's main antioxidant, and a deficiency results in oxidative stress, which can lead to the muscle weakness. Its another symptom is coordination and walking difficulties. Deficiency of vitamin E can cause certain neurons called the Purkinje neurons to break down, harming their ability to transmit the signals. Numbness and tingling is also an symptom is also symptoms of vitamin E deficiency. Damage to nerve fibers can prevent the nerves from transmitting the signals correctly, resulting in these sensations which are also called peripheral neuropathy. Vision deterioration is also the symptom of vitamin E deficiency. Vitamin E deficiency can weaken the light receptors in the retina and other cells in the eye. This can lead to the loss of the vision over time. Vitamin E deficiency also show the symptoms of immune system problems. Vitamin E can a deficiency of vitamin E can inhibit the immune cells. Older adults may also be at risk with the deficiency of vitamin E. Muscle weakness and difficulties with coordination are neurological symptoms that indicate damage to the central and the peripheral nervous system. The peripheral system is the network of nerves located beyond the brain and spinal cord. These neurons pass messages throughout the body. The central nervous system communicates between the brain and spinal cord. The sheets of neurons are mostly composed of fats. When the body has too little vitamin E, it contains the fewer antioxidants that protects these fats, and the function of the nervous system breaks down due to the deficiency of the vitamin E. Severe vitamin E deficiency is expressed in human beings as a spinocerebellar neuropathy that is usually secondary to chronic fat malabsorption. Clinical features of this syndrome include progressive ataxia, incoordination of the limbs, and distal loss of proprioception and vibration senses. Generalized muscles weakness is also the clinical feature of this syndrome. A relationship between neurological dysfunction and vitamin E deficiency was first suggested by Binder in a report on patients with chronic steatorrhea and subsequently confirmed in patients with liver diseases. Vitamin E deficiency have been described in adults with cystic fibrosis and in patients who have undergone extensive intestinal reactions. Fat malabsorption is usually very common in cases of vitamin E deficiency. A primary deficiency of vitamin E is rare, which is from a poor intake of dietary vitamin E. Deficiency is usually associated with the diseases of fat malabsorption, such as cystic fibrosis. Cystic fibrosis is an inherited disorder that causes severe damage to lungs, digestive system, and other organs in body. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids are normally thin and slippery, but in people with the cystic fibrosis, a defective gene causes the secretions to become sticky and thick. Instead of acting as lubricants, the secretions plug up tubes, ducts, and passageways, especially in the lungs and pancreas. Cystic fibrosis is although progressive and requires daily care. People with cystic fibrosis are usually able to attend schools and their works. They often have a better quality of life than people with the cystic fibrosis had in previous decades. Improvements in screening and improvements in treatments means that people with cystic fibrosis now may live into their mid to late 30s or 40s, and some are living into their 50s. The thick and sticky mucus associated with the cystic fibrosis clogs the tubes that carry air in and out of your lungs. This can cause signs and symptoms, such as, for example, I will give you some examples of signs and symptoms of cystic fibrosis, such as a persistent cough and produce the sputum, that is the thick mucus, exercise intolerance, repeated lung infection, inflamed nasal passages, or a stuffy nose. Thick mucus can also block tubes that carry the digestive enzymes from your pancreas to your small intestine. Without these digestive enzymes, your intestine are not able to completely absorb the nutrients in the food you eat. This result is usually associated with the greasy stools, foul smellings, poor weight gain and growth, intestinal blockage, particularly in the newborns, chronic constipation. Severe constipation is the sign of the digestive tract disturbance in the cystic fibrosis, which may include the frequent stirring while trying to pass the stool. Can block the tubes that carry digestive enzymes from your pancreas to your intestine. Without these enzymes, your body cannot absorb the proteins, fats, or fat soluble vitamins, such as vitamin E. So, you can't get enough nutrients. This can result in delayed growth, weight loss, or inflammation of the pancreas. Pancreas produces the insulin, which your body needs to use sugar. Cystic fibrosis increases the risk of diabetes. Just round about 20% of teenagers and 40% to 50% of adults with the cystic fibrosis develop the diabetes and deficiency of vitamin E. The tube that carries the bile from your liver and gallbladder to your small intestine may become blocked and inflamed. This can lead to liver problems such as fatty liver diseases, cirrhosis, and jaundice. Intestinal blockage can happen to people with cystic fibrosis at all ages. Deficiency of vitamin E is usually associated with the disease of the fat malabsorption, which is cystic fibrosis. Without vitamin E, the red blood cells break open and spills their contents due to the oxidation of the polyunsaturated fatty acid in their membrane. This classic sign of vitamin E deficiency, known as erythrocyte hemolysis, which is also seen in premature infants born before the transfer of vitamin E from the mother to infants that take place in the last weeks of pregnancy. Hemolytic anemia is the condition of having too few red blood cells as a result of erythrocyte hemolysis. And erythrocyte hemolysis is the breaking up of the red blood cells. Red blood cells is also known as erythrocytes, a symptoms of vitamin E deficiency disease in human being. Destruction of red blood cells. Red blood cells can live for up to 120 days before the body naturally destroys them. Certain conditions and medications may cause them to break down quicker than usual. Erythrocytes are one of the main components of blood. They have the shape of a slightly indented, flattened disc and help transport the oxygen. Hematolysis. Hemolysis is a natural bodily process that occurs when RBC become too old. As RBCs age, they begin to lose certain properties and work less efficiently. They may lose their deformability, which allow them to reversibly change shape to pass through the blood vessels. Some conditions, some medications and toxins may cause RBCs to break down quicker than usual. There are many potential factors that may lead to the hemolysis. The cause of hemolysis may be extrinsic, come from an outside sources, or intrinsic, which it when it comes from the RBC itself. Vitamin E deficiency in the premature infant is associated with a hemolytic anemia. This anemia responds to tocopherol, and the response is characterized by a rise in hemoglobin and a fall in the reticulocyte count. Treatment of premature infants from birth with supplemental vitamin E reduces the severity of anemia and prevents the reticulocytosis commonly observed in these infants of low birth weight. Vitamin E deficiency appears of a mild compensated hemolytic processes. This is accompanied by thrombocytosis. The erythrocytes demonstrate increased pentose phosphate pathway activity. Tocopherol appears to be poorly absorbed from a low-fat diet in premature infants. In infants with vitamin E deficiency, there appears to be an increase in the creatine to creatinine ratio, lower serum proteins, and an increased excretion in the absence of vitamin B12 deficiency. Vitamin E is highly effective fat-soluble vitamin with a variety of cellular membrane stabilizing antioxidant and non-antioxidant functions. When vitamin E has been suggested to prevent the oxidation of polyunsaturated fatty acids in RBCs, inhibiting the premature erythrocytolysis. Vitamin E increased number of colony-forming units of erythroid precursors, enhanced erythropoiesis and improved blood hemoglobin level. It also improves the post-supplemental blood hemoglobin and hematocrit levels in some of the anemic humans, including low birth weight premature infants, patients suffering from various types of inherited hemolytic anemia, chronic renal failure, patients on hemodialysis, and apparently healthy, mildly anemic humans. Anemia nowadays is a major public health problem, especially in the developing countries. 315 million individuals have been estimated to be suffering from the anemia. Approximately, it is the estimation about worldwide. The causes of anemia are diverse and multifactorial. Leading etiology in the developing countries are usually the nutritional deficiencies. Nutritional deficiencies are the main causes of the anemia in the world. And also major causes are malabsorption, chronic or acute blood losses, inherited genetic defects, chronic diseases, and premature hemolysis of RBCs. Anemia is not a disease, but rather a sign of an underlying illness. Management of anemia should focus on identification and removal of Underlying cause: many of the hematinic micronutrients including folate, iron, vitamin B12, vitamin B6, vitamin A, vitamin C, and the most important, vitamin E deficiency, have been used in the past for the treatment and the prevention of the various types of the anemia. Vitamin E was originally considered a dietary factor of animal nutrition, especially important for their normal reproduction. The significance of vitamin E has been subsequently proven as an essentially required cellular component that can protect the integrity of the cellular membrane and play an important role in various biological processes. Vitamin E is an effective lipophilic vitamin whose major role is to act as a highly potent antioxidant against the damaging free radicals, which are produced as a result of cellular oxidative stress. Premature infants are usually born with the low serum levels of vitamin E, which may predispose them to enhanced RBC hemolysis by free radicals, including the hydrogen peroxide. Treatment of low birth weight infants with the routine pharmacological doses of vitamin E has been suggested to control the hemolytic anemia and correcting the hemoglobin concentration and preventing the development of chronic lung diseases in these premature babies. Vitamin E inhibits the oxidation of polyunsaturated fatty acids in RBC membrane, reducing the fragility of erythrocytes and preventing the oxidative stress-induced premature erythrocyte lysis during various types of hemolytic anemia. Vitamin E has multiple non-antioxidant functions and antioxidant functions. Vitamin E has the potential to be effectively used for preventing or treating some type of the human anemia due to its putative role in promoting the erythropoiesis, enhancing the integrity and stability of erythrocyte membrane, proteins and lipids, and reducing the oxidative stress induced erythrocyte fragility and lysis. This results in increasing the RBC survival and improves the blood hemoglobin level. Prolonged deficiency of vitamin E also causes neuromuscular dysfunction involving the spinal cord and retina of the eye. Neuromuscular dysfunction is a hereditary disease in which the muscles gradually weaken. Its most debilitating effect arise in the lungs. Common symptoms include loss of muscle coordination and reflexes, and impaired vision and speech. Vitamin E treatment corrects these neurological symptoms of vitamin E deficiency, but it does not prevent or cure the hereditary muscular dystrophy that afflicts the children. Shortage of vitamin E can lead to the neurological problems such as difficulty coordinating movements and speech, loss of reflexes in the legs, and a loss of sensation in the extremities. Some people with this condition have developed an eye disorder that cause the vision loss. Mutation in the genes can cause the neuromuscular dysfunction with vitamin E deficiency. The gene provides the instructions for making the alpha tocopherol transfer the proteins, which is found in the liver and brain. This protein controls the distribution of vitamin E obtained from the diet to cells and tissues throughout the body. Vitamin E helps the cells prevent the damage that might be done by the free radicals. Muscular dystrophy is an inherited disease in which the muscles gradually weakens. Its most effects arise in the lungs. Children with this condition do not benefit from vitamin E treatment and usually die at any early age when their respiratory muscles deteriorate. When their respiratory muscles deteriorate, they usually die at any age of their life. Two other conditions seems to be a response to the vitamin E treatment. One is non-malignant breast disease, which is fibrocystis breast disease. Fibrocystis breast disease is a harmless condition in which the breast develops lumps, sometimes associated with the caffeine consumptions. It responds to the absence of caffeine. It can be treated with the vitamin E. Painful, lumpy, and this common condition is not a disease. Many women experience these normal breast changes usually around their periods. Fibrocystic breast changes occur when thickening of the breast tissues, which is called fibrosis, and fluid-filled cysts develop in one or both breasts. It is thought that hormones made in the ovaries during the menstruation can trigger these breast changes. This may make your breast feel swollen, lumpy, or painful, or during your period each month. And vitamin E seems to be very helpful in the prevention of these fibrocystic breast disease. And this disease responds to the vitamin E treatment. And the other condition is abnormality of the blood flow that causes the crampings in the legs, which is intermittent claudication. This is the severe pain in your calf by inadequate blood supply. It occurs when walking and subsides during the rest. Intermittent claudication is a symptom of leg atherosclerosis, usually exhibited in older adults, which occurs in 0.5 to 14% of different populations. People with intermittent claudication experience the pains in the calf of one or both legs when they are walking. Symptoms are caused by atherosclerosis in the major arteries of the legs, resulting in decreased blood flow. When oxygen demand increases during exercise and during any walking, blood supply is inadequate and ischemia develops, which is the shortage of the oxygen. The cause of the pain is not about the ischemia. When the patient takes a rest, for instance, looking in a shop window, oxygen demand increase and the pain disappears. During the resting conditions, oxygen demand decreases and the pain disappears. Major risk factors for the intermittent claudications are cigarette smoking, hypertension, high cholesterol, hemostatic factors. Many patients with intermittent claudication have mild complaints. Up to 20% of the patients go on to the reconstructive surgery. Patients with intermittent claudications are advised to stop smoking and to start the specific exercise programs. The treatment of intermittent claudication with vitamin D has had its proponents since the 1940s. Important function of vitamin E in the body is the protection of polyunsaturated fatty acids from their oxidation. Polyunsaturated fatty acids are highly susceptible to oxidation by endogenous free radicals, which are formed and needed in the normal cell metabolism. Exogenous free radicals absorbed for instance from the cigarette smoke and cause the oxidation. The cell damage that occurs in ischemic periods in all tissues is caused by the free radicals. Vitamin E protects the mitochondria from the consequences of the ischemia. Vitamin E deficiency, abnormal erythrocytes, and sometimes anemia are found in these patients. Vitamin E deficiency can cause all these problems. Deformability of red blood cells may be enhanced by the vitamin E. Polyunsaturated fatty acids incorporated in the membranes are protected from the oxidation, and vitamin E inhibits the platelet aggregation. Vitamin E has the ability to lower the blood cholesterol levels and to stimulate the formation of collateral vessels. Improvement of any type of physical working capacity by vitamin E is also subject to the controversies. Vitamin E might improve tolerance to the ischemia that occurs during the exercise. If indeed it eliminates the free radicals, it might influence the process of atherosclerosis by stopping the further deterioration. Patient with the ischemic heart diseases and the patient with the peripheral arterial diseases have higher plasma lipid peroxide concentrations. Inhibition of peroxidation by the vitamin E might influence the beneficially balance between the peroxidative damage and the body's repair mechanism. It may also influence the platelet aggregation and affect the red blood cells, improving blood flow, which might account for some beneficial effect on the symptoms of intermittent claudication. All these diseases respond to the treatment of vitamin E. Vitamin E plays most important role in the prevention of all these diseases.